Colon cancer warning signs you should never ignore. Most people are unknowingly ignoring colon cancer warning signs that could change their life forever. Subtle shifts in your body, things you might brush off as nothing, could actually be early red flags that doctors say are critical to catch. In this video, I'm exposing 4 warning signs most people completely miss, and one of them is so sneaky, it could already be happening to you. Stay with me until the end, because recognizing them early can literally save your life. The first sign of colon cancer is a moment that can stop you in your tracks, going to the bathroom and seeing something unexpected in the toilet. It might seem like a small, harmless issue at first. After all, who hasn't experienced a little irritation down there? But what if that small issue is something much bigger? Could this minor inconvenience be telling you something more serious is going on inside your body? One of the most overlooked yet critical signs is blood in your stool. Seeing blood can take many forms. It could be bright red streaks on your toilet paper, blood in the toilet bowl, or even blood in your stool itself. The sight of it is alarming, but it should never be ignored. Though it's tempting to brush it off as something trivial, blood in your stool can be a critical warning sign of colon cancer. Colon cancer doesn't always come with loud or obvious symptoms. In fact, this could be one of the earliest signs, and spotting it early can be life-saving. Research backs this up. Blood in the stool is one of the most common early signs of colon cancer, with studies showing that 20% of people diagnosed with colon cancer report this symptom in the initial stages. If blood shows up, even just once, it's crucial not to delay. The best course of action is to get a colonoscopy right away. Waiting to see if it goes away could cost precious time in addressing a potential issue early. Colon polyps or rectal bleeding could be precursors to something more serious, and identifying them before cancer develops is vital. It's important to remember that not all blood in your stool is caused by cancer. Sometimes, conditions like hemorrhoids or anal fissures can be the culprit. However, it's always better to err on the side of caution when it comes to your health. Colon polyps and rectal bleeding are known to precede colon cancer, and getting checked is the safest move. Early detection of colon cancer drastically improves your chances of successful treatment. Don't let uncertainty cloud your judgment. Take action, get checked, and stay ahead of your health. Now that you're aware of how important this sign is, let's dive into another symptom that could reveal even more about your health. Before we move on, I'd love to know where you're watching from. If you're a senior looking to naturally ease health problems, make sure to subscribe to Knowhow and turn on the notification bell. And if this content helps you, type 1 in the comments. If not, type 0. I want to keep improving for you. Feeling discomfort in your abdomen might seem like something that will pass. But what if it's your body trying to tell you that something deeper is at play? Many people brush off occasional abdominal pain, but when it becomes persistent, it might be trying to warn you of a serious issue. Do you ever experience bloating or cramps that just won't go away? Does your stomach feel full, even when you haven't eaten much? While these might seem like minor inconveniences, they can be a sign of something more concerning. Persistent abdominal discomfort is often one of the earliest colon cancer warning signs many people overlook, but it's not a symptom that people typically connect to such a serious disease. In fact, studies have shown that nearly 30% of people with colon cancer experience stomach pain before being diagnosed. The key here is persistence. Occasional stomach aches or bloating might not be alarming, but when these discomforts become constant or recurrent, they deserve attention. If you're dealing with discomfort that doesn't seem to resolve or worsens over time, it's time to seek medical advice. When cancer affects the colon, it can lead to blockages or irritation in the digestive system, causing ongoing pain and discomfort. The good news is that persistent abdominal discomfort doesn't always mean cancer. There are other conditions, such as irritable bowel syndrome or gastrointestinal issues, that can also cause similar symptoms. However, the most important thing to remember is that this pain shouldn't be ignored. It's better to have it checked out, as early detection of any underlying issue can lead to more effective treatment. So, what happens next when your body starts giving you these signs? Well, there's another symptom that could catch your attention, one that might leave you feeling confused and concerned. Is it just stress or something your body is trying to tell you? Keep watching as we uncover this important sign next. What if the number on your scale suddenly drops without any changes to your eating habits or exercise routine? You might think it's just a fluke, but could it be a sign that something isn't quite right? Unexplained weight loss is one of those symptoms that often flies under the radar, and it's easy to brush off as a random occurrence. However, when it happens without any clear reason, it could be trying to tell you something more serious is going on. This isn't just about shedding a few pounds here and there. We're talking about significant, unintentional weight loss. When colon cancer begins to take hold, it disrupts the body's ability to absorb nutrients properly. As a result, weight loss can occur even when you're not trying to lose weight. Research shows that about 15% of people diagnosed with colon cancer report experiencing unexplained weight loss as one of the first signs. And this weight loss is rarely an isolated symptom. It's often accompanied by other signs like fatigue and weakness, leaving you feeling drained with no explanation. If you've noticed a sudden dip in your weight, it's important to pay attention to the context. Are there other symptoms, like blood in stool or persistent abdominal discomfort, that accompany the weight loss? If so, don't wait for it to resolve on its own. Consult with your doctor and get checked. Unexplained weight loss, especially when paired with other symptoms, can indicate that cancer is affecting your metabolism and may be advancing. Early detection is key to improving your chances for effective treatment. But what if there's another subtle sign that might be trying to warn you of a problem with your colon? Stay tuned as we break down this next red flag and why it matters. If you're finding this helpful so far, please take a second to like this video. It may seem small, but it tells YouTube that this message matters and helps Knowhow reach more people who truly need it. If you believe others deserve this knowledge too, tap that thumbs up now. Changes in your bowel habits are another key colon cancer warning sign you shouldn't ignore. Maybe you notice that your trips to the bathroom aren't as routine as they used to be. Perhaps you feel like your body is sending mixed signals, leaving you confused and frustrated. It could be something as simple as a shift in your diet, or it could be a sign of a more serious issue, like colon cancer. Whether it's persistent diarrhea, constipation, or alternating between the two, these changes can indicate something is wrong inside your digestive system. When colon cancer develops, it can cause a blockage or obstruction in the colon, disrupting your normal bowel function. You might experience thinner stools or find that you feel the urge to go but can't fully empty your bowels. These symptoms might not seem alarming at first, but they are often some of the earliest signs of colon cancer. The American Cancer Society reports that changes in bowel habits are one of the most common early indicators of colon cancer. For many individuals, these changes appear before other symptoms, such as abdominal pain or weight loss. If you've noticed a significant change in your bowel movements that persists over time, it's essential to take action. Your body is trying to tell you something important. While changes in bowel habits can result from many different conditions, including stress or dietary changes, it's always better to be safe. Ignoring these changes could allow a potential issue to worsen. Early detection is crucial for preventing further complications. So, if you notice any shifts in your bowel patterns, especially if they're accompanied by other symptoms, don't wait. If this video was helpful, please don't leave without subscribing to Knowhow. And if you feel like I truly understood your struggle and offered a solution that matters, type the word relief in the comments. I'd love to know if this helped you.